thank you so much. It's being recorded for joining us this morning for the Community Health Needs Assessment Roadshow. For this slideshow, I was asked to provide a picture specific to Maricopa County's Northwest region, and I chose a picture with the F-35 fighter jets from Luke Air Force Base, which is headquartered in the Northwest region. I'm proud to say that Luke Air Force Base is home to the 56th Fighter Wing and is the largest fighter wing in the U.S. Air Force, right here in the Northwest region. You know, Luke's Air Force Base economic impact in Arizona is over $2 billion a year. And I thought it was appropriate with Veterans Day around the corner to take time to thank our veterans and their family members and recognize their service and sacrifice to our country. I also want to say, I'm Martin Nowakowski with Public Health. Joining me on the Public Health team is Tal Lamb, who's going to be helping out with the chat, and Jessica Francis, who will be co-presenting with me today. And on the next slide, we'll show you what the agenda looks like. Next. So let me start off by telling you a little bit about what I know about the Community Health Needs Assessment. Every 3 years, the county, in collaboration with the community, with organizations, municipalities, and our healthcare partners, we conduct a survey to develop a deeper understanding from residents about issues related to quality of life, availability of essential services, issues like physical and mental health, and much more. So the information gathered from the survey facilitates planning and guides the work towards making Maricopa County a healthier place for us all. So in the next hour, we're going to be taking a deeper dive into the data results that include insights into regional trends and some key findings. On the next slide, we will review today's objectives. So as you can see, today's objectives are for you to understand the CHNA process and its impact. So today's an excellent opportunity for you to all engage with the data, ask questions, and understand the impact the survey can relate to our community. You're going to know where to access the data and the value it can provide to your organization. And as you see the value of this data, I'm really hoping that you will support our next CHNA cycle, which is in 2026. And the foundation work for that cycle is today, right now. It's always being worked on. Next slide. So housekeeping. So, like I said, we'll save some time at the end to answer questions. But due to limited time, we're asking that you place your questions into the chat, and we will make sure to answer them at the end of the presentation. Near the end, we're going to provide a QR code and ask that you please complete an evaluation. And y'all are going to have nice things to say about your public health liaison, right? The Northwest CHNA Roadshow is being recorded, and that'll be available to you in a few weeks. And like I said, joining me are Jessica Francis with CHNA team and Tal Lamb, who's monitoring questions in the chat. Next slide. Meet your MCDPH liaison. Here I am. So I know I've had the pleasure of meeting and collaborating with many of you. So I won't take too much time in my introduction. But I've been a public health liaison since 2020. I seem to time it perfectly. When I joined, I had no idea that I was joining public health right before the largest public health crisis of the century. Of course, I'm talking about the COVID-19 pandemic. It was a introduction, sort of like a baptism by fire into public health. But I was able to witness so many healthcare heroes working 24/7. I gained an appreciation for the honorable profession I was now a part of with Maricopa County Public Health. My role as a public health liaison, I serve as a bridge between public health and the communities within the Northwest region of Maricopa County. So I'm often asked, hey, what's your favorite part of working as a public health liaison? And I say, it's building those trusted relationships. I get to witness how partnerships and collaborations between public health and our community partners are able to amplify our reach and improve our mutual outcomes. So I spend a lot of my time in the community, engaging with community and enjoying my interactions with sectors such as local government officials, community-based organizations, school districts, nonprofits, and the numerous businesses located throughout the Northwest region. I have the pleasure to meet and engage with many of our civic and community leaders. What I'm really saying is I have a great job. Enough about me. Let's move on to the next slide. So, Maricopa County, we're the fastest growing county in the nation, and we're actually the third largest public health jurisdiction. And due to the size of the county, we have like 4.6 million in population, 25 municipalities within Maricopa County. Public health decided to create 5 public health regions to meet the growing health needs of our diverse population and our extra big county size. The Northwest region, as you can tell, is home to the cities of, in alphabetical order, Glendale, El Mirage, Peoria, Surprise, Wickenburg, and Youngtown. We also have some great unincorporated communities, that of Sun City West, Morristown, Whitman, and the farming community of Aguila. If you work, live, or visited the Northwest region, perhaps you've gone to an event at the Cardinal Stadium, maybe a Super Bowl, maybe a NCAA Final Four, or even a Taylor Swift concert. If you haven't been there, but maybe you've enjoyed another sporting event like the Cactus League, the spring training home to many of our professional baseball teams. Right now, the Dodgers are in the World Series, so they're based out of Glendale. But we also have great amenities like, I'll call it the tranquil waters of Lake Pleasant, where you can camp out or cool off in the lake, or scenic sites such as the White Tank Mountains. Maybe you visited Wickenburg, our roping capital of the world, not just the nation, of the world. So the Northwest region simply has so many great cities, sites, and cultural events going on. Next slide. Now to the CHNA overview, where we'll take time to describe the CHNA process and its impact. And we're going to identify the survey findings specific to the Northwest region and our cities. So next slide, we're going to see a video. And the video we're providing is an overview of why we do a CHNA, how the data is collected, and how we share it with community health partners, and why participation from our cities and community partners is so important. Let's play that video.
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County through our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a Community Health Needs Assessment, also known as a CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, you can better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these 2 surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact.
So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership of Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote the survey among our networks, both virtually and in person, will help ensure that we capture the most representative community data. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
Video. I hope you got as much out of it as I did. On this slide, so it shows in early 2023, we put out a call for community engagement, and y'all stepped up to the plate. With your support, we collected the highest number of responses to date, over 18,000. That's incredible for a community survey. What was really great is that we also increased the number of representative responses. So on this slide, you can see where we were able to collect a good amount of data within some of our priority populations. So you see here we have veterans at 990, people living with disabilities over 1,300, the LGBTQIA plus community over 2,000, and our refugee, immigrant, migrant over 1,600 surveys. That's outstanding. So we also received a high number of surveys within each of our 5 public health regions. As you can see, the Northwest region collected 2,658 surveys. Phoenix led the way, of course, with over 6,000. So because of the large amount of responses collected and where they came from, it makes us feel much better and excited in developing our efforts and tailoring our outreach and resources. When identifying the needs within each region and the diverse populations residing within Maricopa County, I think we nailed it. Next slide. So it took a lot of strategic planning and a lot of working in partnership, but we were able to collect enough responses to publish 15 city profiles this time around, compared to 12 city profiles last cycle. As you can see in the Northwest region, we had 3 cities, Glendale, Peoria, and Surprise, that qualified for their own city profile. And you might be asking, like, wow, how does a city qualify for a profile? Well, you have to obtain at least 250 responses from residents living in your city. So due to working in partnership and collaboration with our community partners, we were able to add Avondale, Tolleson, Fountain Hills, and Queen Creek to the list who made the mark for their own city profile. Next slide. So on this slide, a quick glimpse as to where some of our cities and towns ended up with survey totals. Keep in mind, although these cities, towns didn't get enough responses for their own profile, these totals of responses are included in the regional numbers and the countywide responses. For each region, it should be our goal to have more of our city and towns get their own profile in the next CHNA cycle. My thing is, let's roll up our sleeves and make that a reality. Just think about it for a minute. If we get 10 organizations in each city or town to collect 25 surveys, we can make this happen. That's easy. We can do it. Like we say, si se puede. Next slide. So this slide, total surveys collected throughout Maricopa County were over 18,000, and the total in our Northwest region over 2,600 surveys. If you live in Maricopa County, you understand that we're made up of a very diverse population. We're like the United Nations of counties here in Maricopa County. And this slide gives you an idea of the many different types of community-based organizations that assisted public health with survey collection. It helped for culturally appropriate survey recruitment. We wanted to be wherever our populations were. So the last cycle of collection, we had over 23 community-based organizations actively assisting public health with the data collection. They did it within their respective communities and service areas. Organizations that helped us out in the Northwest region included the Glendale Elementary School District and the International Rescue Committee, the IRC. Next slide. Here is the keys to our success. You know, it's basically meeting the community where they are at, working in partnership and having a good plan. The truth is, if you were invited to this meeting, I view you as a key to unlock our success for the next time. So, you know, Glendale, Wickenburg, Surprise provided a space at some of their city-sponsored community special events. Thank you for doing that. Peoria, you allowed us in your community centers. Thank you for allowing us. In the picture above, you see the public health liaisons at a park where each Sunday morning, dozens of unsheltered individuals, you know, the people living in the shadows, they're being served a warm breakfast by Marvin's Mission. We were there collecting surveys. And here I am speaking with seniors at a church in Sun City. In that bottom picture, I'm out in Wickenburg on a bridge over the Hasayampa River for an event called the All Vultures Eve annual event, where you're able to witness hundreds of these migrating turkey vultures flying in to roost in the tall trees along the river. Really exciting, but we're at where the people are. Next slide. So collection of the data, it's not always easy, but we engage the community like we never did before. I am proud to share that during the 18 weeks of collecting data, we had 68 staff and volunteers attending 187 community events. We spent over 1,300 hours collecting data at these events. Cannot stress the importance. For those of you who participated, thank you again for your support. And for the rest of you, I know that you'll be ready to roll up those sleeves for the next cycle. Just remember, we need 10 groups in your city to collect 25 surveys for that profile. We can do that. As an extra incentive to filling out the surveys, last time we gave away about 4,500 gift bags. That included a summer kit with a cooling towel and sunscreen, a lunch kit with a salad shaker and bamboo utensils, and a emergency kit with a flashlight and other stuff I can't remember right now. But now I've spoken enough. Let's get down to the business why we're all here. You're now going to be hearing from the amazing, the one and only Jessica Francis with our CHNA team. Jessica will be sharing CHNA findings specific to the Northwest region, and you will see how that information compares to Maricopa County wide district or data results. Jessica, if you can please share a little bit about yourself before we dive deeper into the Northwest region, that would be great. Take it away.
Thank you so much for that warm welcome, Martin. Hello, everyone. My name is Jessica. I am the Community Health Assessment Coordinator here at Maricopa County Public Health. And most of the work that I do resolves directly around the CHNA survey, the results of which we'll be going over in just a moment. Just working with organizing the events, coordinating who's going to be going to what locations, and then helping with a lot of items on the back end with entering paper surveys, cleaning up data, and a lot of communication and project management. So I'm very happy to be with you all here today to talk about the results. And let's dive right in. Oh, something I wanted to note, however, before we dive right in, is that, as Martha mentioned earlier, we wouldn't have been able to collect all these results without the support of all our community partners. We're excited to share these results, not just for the Northwest region, but also for 3 cities that we were able to create a profile for. So in this next section, I'm going to be going over what you need to know to access this data and share it with your community, so that you can use it, for example, programming policies or for writing grants. And I'll go over the background of how we collected the data. As we go along, Tal will be dropping links in the chat for where you'll be able to access this information. And no worries if you don't click on it during this presentation, we'll also make sure to send out a follow-up with all these links that we'll be discussing. As a reminder, at this time, if anyone has any questions as we go throughout the presentation, please feel free to ask in the chat to Martin, myself, or Tal, and we'll make sure that we get to it at the end during the Q&A session. So I just want to go over the past couple of years of survey collection that we've been doing. Starting in 2012, we started with providing the survey in a paper format in English and Spanish, and we were able to just collect about 1,000 surveys. As time went on, in 2017, we were able to start providing mini grants for our community partners to be able to sustainably support us in this work. And then by 2019, we also added a virtual format of the survey. This was right before COVID. And then we also took on a more regionalized approach with our public health liaisons like Martin, making sure that we were getting responses from all different regions of the county so that we could hear all different perspectives of what health looks like here in Maricopa County. Going over into our primary data collection methods, we have our community survey, which we'll be going into the results of. We did in-person and virtual recruitment, and we set very specific recruitment goals so that we could get the most representative picture we could of Maricopa County. So this looked like setting specific numbers for each regions, for different cities, and for different demographic populations. We made sure that this survey tool we designed this year was more accessible so that we provided large font for those who needed to be able to see a little bit better. We partnered with Savi, Services for the Blind. They were able to create a Braille version of the survey. Other options that we had is we offered the survey in 13 additional languages, and that was both in virtual and paper. We also had focus groups so that we could dive a little deeper into some of these issues. A lot of questions we asked on the community survey was like, rate your health on a scale or pick one of the options. So with these focus groups, we were able to sit down with community members and hear a little bit more from their lived experiences and stories of why residents might answer one way or the other on the CHNA survey. Those focus groups were conducted in English and Spanish, and we did conduct it with a county vendor. And we had key informant interviews as well. We did those virtually, and it was to hear from different community leaders in various sectors, such as business or philanthropy, to hear how are they seeing health in their communities and the regions that they serve. And again, that was also conducted with a county vendor. So most of the results that we'll be going into later are from the community survey, the CHNA survey. But we do recommend for anyone who's interested into looking into those various reports, you can scan the QR code that's on the screen, or you can also visit our website, maricopahealthmatters.org. So before we dive really deep into the data, I just wanted to make sure that we're all on the same page with how the data is being interpreted. So many here in this group might be very familiar with the numbers and looking at tables, and some of us might be new. So I just wanted to make sure that we're all on the same page. So most of the slides that we'll be going over today are going to be in this similar format. At the top of the screen, you'll see the question that we asked residents. In this example, it's how would you rate your physical health? And you'll also see the options that were provided. In this case, it was good, fair, or poor. So that first bar that you see there, that says 8% overall, it's showing the percentage of all participants who answered the survey, in this case, poor physical health. They rated their health as poor. When we look deeper into the data and analyze the results by different demographics, we did ask participants about their race or ethnicity, their age, their gender, their income, and their focus, which population they may be a part of that we're paying particular attention to. We were able to see how health responses vary by different groups. So each of the percentages that you see below are a total number of participants who identified with a specific group. and what percentage of that group selected this answer that we're presenting on the screen. So when we looked at which groups have the highest rating of poor health, we found that 28% of survey participants who identified as disabled rated their health as poor. Of all the survey participants who identified as unhoused, 22% rated their health as poor. And of all the participants who who reported having an income of less than 15,000, 15% reported their health as poor. So as you can tell, these percentages do not add up to 100. That is because these different demographic questions were asked in different questions, as well as we all know nobody has just one identity or one aspect to them. So these numbers that you see here are just looking at individual groups. It's not factoring in that intersectionality. So these numbers won't be adding up to 100%, but they will be showing when we look at groups by different demographics, which groups had the highest percentage of people rate their health. That's one. So another way that you can interpret these results is that over 1 in 4 disabled respondents and 1 in 5 unhoused respondents reported poor physical health when compared to 1 in 12 overall respondents who took the survey. So another way that you can interpret this data to make it more actionable for your organization is that disabled and unhoused respondents report the highest rates of poor health and may benefit from additional support and resources. I just wanted to double check at this time. Is there any questions on this explanation of the data interpretation? Okay, hearing none, then we can get right into the results. So if you scan the QR code on the screen, you'll see the profile that we created for the Northwest region, and we'll be going over into that in more detail now. For those who want to see all the numbers and all the tables, I just want to quickly plug again, maricopahealthmatters.org is where you can find all the information for the overall county, the different regions, and the different cities. So we had a grand total of 2,658 participants take the survey. The data on the screen that we're showing here for demographic data on the left is comparing the demographic data we collected from survey participants to US Census data. So two things I want to know before we dive into this data is that we did not ask, are you Hispanic or Latino as a separate race question as they do on the census. Based on community feedback, we included it as one of the multiple options participants could choose when we asked which race or ethnicity do you identify with. And then another thing we wanted to know is that on the survey, we did ask as an option if you identify as Middle Eastern or North African, and we do not have US Census data available for that, so you will not see that here on the screen, but that if you want to see the results of how many participants identify as Middle Eastern or North African, you can check that out in our CHNA survey report. So looking into the numbers, you're able to see on the left side here that we had higher representation in our survey respondents for the Northwest region, for our American Indian or Alaskan Native respondents, our Asian, our Black or African American, our Hispanic or Latino X populations. And we're really excited to share these results and more representative results than we have in the past. I do want to know for our white or 2 or more races, it is a bit lower than what the demographic data shows for the Northwest region. And every year we are trying to make our survey data collection better and better so that for all groups, we are able to get that representative data. When looking at those who responded to what is your age, we did see much less representation from those ages under 18 years old, and that is due to the cutoff for the survey being 12 years old. So you had to be 12 years or older in order to take the survey, so that's why we see that low result. But we were able to get a much closer representative number for those ages 65 and older. For those who identify as male or female, we see underrepresentation from our males and overrepresentation from our females. This is something that we've consistently seen throughout our cycles and is also something that we're working towards to hear more from our male respondents in Maricopa County. And then looking at income, we were able to get pretty similar representative results for those making an annual household income of less than 50,000 and those who make an annual household income for more than 200,000. So now we're looking more into how respondents rated the different questions. For each slide, you'll see on the left the overall results for all of Maricopa County. And then on the right, you will see results for the Northwest region. As we continue on, if there are any results that are different for specific cities, we will highlight that here on the screen. So for this first question, which health issues have the most impact on you and or the people you live with or care for? We see that some of the top responses were anxiety, depression, high blood pressure, chronic pain, and diabetes for both Maricopa County and the Northwest region. We also asked participants to rate various assets in their community, and they could have rated them as poor or very good. So for assets that were rated as very poor, we see that for Maricopa County, the assets that were most rated poor were access to affordable housing and access to quality public transportation. For Maricopa County, the third highest was ability to communicate with local leadership and feel my voice is heard. But for the Northwest region specifically, you can see, as is outlined in red, that it was access to quality and affordable childcare that was actually part of the top 3 most poorly rated assets. In the top right corner, we're also showing for different cities what might have been a different response that was rated poor for the top 3. So for the city of Glendale, similar to Maricopa County results, we saw that ability to communicate with local leadership and feel my voice is heard was one of the top 3. And for Surprise in Peoria, access to affordable education for high school was rated as poor. And so as we're going through these presentations, I'm very curious to know if anyone wants to put in the chat if these results are looking as you expected, or if they're very different from what you were expecting. So when we asked residents in the community, how would you rate these assets? The top rated assets, the assets that are top rated is very good for Maricopa County and the Northwest region, were access to parks and green spaces and feeling safe in your home. For Maricopa County, part of the top 3 was an opportunity to participate in religious, spiritual, or cultural events. Whereas for the Northwest region in particular, it was access to public libraries, community centers, and educational events. When we look at city breakouts for Peoria and Glendale, it was similar to Maricopa County results. The opportunity to participate in religious, spiritual, or cultural events was also part of the top 3. And for Surprise, they also had access to parks, green spaces, and feeling safe, as well as access to safe walking or biking paths. When we asked respondents, how would you rate your physical health? In Maricopa County and Northwest region, the rates were a bit similar. It was 8% and 9% overall. When we broke out the data to look at how residents rated their health as poor by different demographic groups, for Maricopa County, it was 28% of our residents who identified as disabled, 22% of our unhoused survey participants, and 15% of those who made an income less than $15,000. When we looked at the Northwest region, they also had similar results, those who were disabled and those who identified as unhoused, but the third highest group was actually those who identified as being homebound. When we asked participants, how would you rate your mental health? For those who reported a poor mental health, in Maricopa County, it was about 10% of all respondents, and in the Northwest region, it was 9% of all respondents. And the top groups that rated poor health the most were similar for both regions. It was 22% of our unhoused participants, 22% of our LGBTQ plus participants, and 18% of our participants ages 12 through 18 for Maricopa County. And for the Northwest region, we see similar percentages. We see 23% for unhoused participants, 20% for LGBTQ plus participants, and 20% for those ages 12 to 18 years old. We also asked residents, how often could you get medical care when needed? Those who reported the most difficulty getting medical care, we see that overall for Maricopa County, it was 36% of residents. And when we look at the breakout groups, it was 65% of those who identified as Native Hawaiian or Pacific Islander, 53% who identified as unhoused, and 51% of those who identified as a refugee, immigrant, or migrant. We see similar results for the Northwest region. It was 37% of all participants, 50% of our unhoused participants, 49% of our refugee, immigrant, or migrant participants, And then the third highest group for our Northwest region was actually those who make an income between $25,000 and $35,000. When we asked participants how often could you get mental health care when needed, for Maricopa County, those who said sometimes or never was about 56% of all participants. When we look at the breakout groups, it was 78% of our Native Hawaiian or Pacific Islanders, 72% of our refugee, immigrant, or migrant groups, and 67% of our Asian participants. For the Northwest region, we see a bit different results here. 55% of Northwest regions and Northwest residents in the Northwest region said they had difficulty getting mental health care. The highest group was actually those who identified as multiracial at 73%, 69% of those who identified as a refugee, immigrant, or migrant, and again, 65% of those who reported making an income between $25,000 and $35,000. We also asked residents what would help you get the care you need. Residents in Maricopa County and the Northwest region both identified having access to evening or weekend appointments and a lower out-of-pocket cost for services. In Maricopa County, the third highest tool or asset was having more appointments available in general, whereas in the Northwest region, it was having the ability to access multiple services at the same location. In Surprise and Glendale, we saw similar results of being able to get evening or weekend appointments or lower out-of-pocket costs for services, as well as more appointments available. So we know that many here are doing a lot of work addressing substance use in the county. And so we wanted to just highlight some quotes of what our residents said through our focus groups. We have on the left here from a low-income youth focus group, they mentioned that what possesses someone to do harm to someone or to get into substance use is lack of education, not being able to understand their emotions or understand their relationships with others. From one of our youth focus groups, they mentioned that there is an issue of substance abuse in schools and that those who need help, they don't need to be punished for it. Rather, they need guidance. They need resources to be able to help them to push them on the right path. We were also able to get some responses about how residents feel about substance use on our last question of the CHNA survey, which was what additional thoughts do you have about you or the health of your community? And so we had a resident from Glendale said that they feel that the issues of homelessness and substance abuse could be much better addressed at the local, county, and state levels, that our residents need a place to live in order to be able to get that help to address substance use. From El Mirage, we heard that substance use among teens is growing and that there needs to be more education and there needs to be more understanding of the impact and consequences that drug use has. And from our resident in Surprise, we had a recommendation that they would like to see more free or low-cost access to physical and mental health needs, support, or treatment, as well as less stigma against those who are using substance use so that they can get access to housing support and really be able to address their health. So if you would like to hear more about what did our residents say through our focus groups on other issues as well, such as affordable housing or how the economy is doing and how stable they're feeling, you can check out our profiles at maricopahealthmatters.org. You can hear more from our community leaders through our key informant interviews and see what data we analyze through our population data report. If there's anything that after going through all these different reports and profiles, there's still something that's missing, feel free to submit a data request with our epidemiology department. They usually do get back to you within 2 weeks. And if there's any clarification needed, they'll get back to you to make sure that they're getting you exactly the data that you need. And we would love, if you have any questions or you would like to get more involved, definitely reach out to Martin. If you have any specific CHNA questions, you can definitely email us at maricopahealthmatters@maricopa.gov. So now that we've gone over all this data, what can we do with this data? What is our next steps? So we just want to address what Maricopa County plans to do in our community health improvement plan, how you can get involved with the community health improvement plan, or even how you can get more involved in the upcoming 2026 CHNA cycle. So our community health improvement plan, like the survey we just did, it's completed every 3 years. It is a requirement for public health accreditation, but it's also important to create a plan with the data that we collect from our community health needs assessment. It helps us set priorities, coordinate and target resources, and define coordinated actions in conjunction with the community. So it's not us making decisions for the community, but working with the community to address these important issues. So the top 5 priorities that we saw rise from the data that we discussed with the community was mental health, access to healthcare, access to healthy food, substance use, and housing or homelessness. These are the official priorities that we are addressing in our CHIP. And I'm wondering, I'd like to see if anyone would like to chip in. How do you see these topics impacting the communities that you serve? Martina, are you getting any comments in the chat? No worries, you can feel free to noodle on it as we continue on, but would love to hear from everyone. So how you can get more involved. In our quarterly partner meeting back in September, we really started kicking off this work. We went over much more detailed data for each of those top 5 priorities. We broke up into groups and we talked about what's already happening in the community, what's most urgent, and if there's any more data we'd like to see. We just had our first 2 subcommittee meetings, which is where we invite community members to come specifically talk about each of the 5 priorities. We had our first one in October and our second one October 23rd. Our third one is coming up November 20th. We're still in the process of just finalizing what are the goals that we want to have for each of these priority areas. So we haven't started any of the work or even creating the plan. We're just in the goal phase. So we would love to have you all come out. If you want to scan the QR codes that's on the screen to register for the next meeting, it is over Zoom and it'll be from 12 to 2 p.m. If you're not able to make those Zoom meetings, we would love to see you at our Health Improvement Partnership in Maricopa County quarterly partner meeting in December. This is where partners will come together and we will talk about what are the outcomes and the goals that we have decided from these meetings. What is the trajectory that we want to take for each of these top 5 priorities and who we'd like to have at the table, which is really, we'd like everyone to come to the table and provide your input, provide your resources so that we can really address each of these goals over the next coming years. So if you would like to learn more, you can check out our website, hipmc.org. If you would be interested in learning about what is the Health Improvement Partnership in Maricopa County and you'd like to get involved, you can contact the team at hipmc@maricopa.gov. And just to preface, for the CHIP work, you do not have to be an official partner, so we would love anyone to come. You can contact the team if you just like to learn more about becoming an official partner. And if you just want to stay updated, for example, when is the next registration coming out for that December meeting, we recommend subscribing to our HIPMC newsletter. There you'll also get to see what other community partners in the HIPMC are providing, whether it's resources or events, and then also just being able to stay up to date on what the county is doing with the CHIP and the CHNA. So we would love to hear from you. At this time, I'll pass it back over to Martin and we can address any questions that myself or Tao may have gotten in the chat here.
See any questions in the chat that need to be answered right now? If not, I hope today's roadshow helped to understand how you're able to access the information and use it towards your work, and because it really serves to guide our work here at Public Health. Just recall that having this data available to both identify and prioritize issues in our community, it serves as a document that guides and helps in our planning and allocation of resources, not just financial, but also our human resources, our personnel, staff to address those problems. So, and we really hope that you see the value and how it can serve your organization in the same way. So if you go to maricopahealthmatters.org, you can access a lot of this information, see the different city profiles throughout Maricopa County, what's happening in the, Northeast, Southeast region, Southwest, Central, and along with the Northwest. So it's a valuable tool.
It looks like, Martin, we did get some questions here.
Right on.
Someone asked, is the results broken down by age as well, or just race? So we did break it out by multiple demographic groups, race. We had a question that asked, which population do you identify as? And there was different options, such as those who are unhoused, those who are homebound, our military members or veterans. So all those results, we didn't present all of them here, but they are available through our county survey report on maricopahealthmatters.org. And then we had another question, is it possible to obtain these presentations? So I believe Martin, after, will be sending out a follow-up email with the links to the different presentations. And I believe we will also be uploading this recording to our website, and we'll also make sure that it's included in that follow-up email. Just wanted to give a couple more seconds in case anyone had any last-minute burning questions they wanted to ask. While we're waiting, I do also want to note that we have an evaluation that we'd love if you could fill out. This helps us just make sure that these presentations that we offered are relevant to you and to your organization. So we'd really love to have that feedback so that we can make this even better. Okay, well, if there's no more questions, I'll pass it over back to Martin to close us out.
No, just thank you for your time. And I really hope we have your support for the next cycle. So that even though it's in 2026, the foundation and planning starts now. So I want to see us roll up our sleeves and get a city profile in each of our Northwest region cities. So thanks again to all of you for joining us, and have a safe time. Thank you.
Everyone.